Welcome to KidzDocTalk with Dr. Jennie. This is the last episode of Season 2, where we will talk with Dr. Kalika about neurodiversity. You may remember Dr. Kalika from an earlier episode where we talked all about headaches. Dr. Kalika is an assistant professor of clinical neurology and pediatrics at University of Miami. She was born in Brooklyn, New York, and graduated from Cornell University in the year 2000. She earned her medical degree at the University of Medicine and Dentistry of New Jersey School of Osteopathic Medicine. She completed her residency in pediatrics at Jersey Shore University Medical Center in 2007 and her fellowship in Child Neurology at SUNY Downstate in Brooklyn. She is board certified in neurology with special qualification in child neurology and is pursuing certification in headache medicine. When not seeing patients, Dr. Kalika enjoys reading, baking, and spending time with her husband and children. She is slowly amassing an impressive collection of geeky dresses with pockets. She is a fan of Florida winters and still not Florida summers. Welcome back, Dr. Kalika.
Welcome to KidzDocTalk with Dr. Jennie. Dr. Jennie is a board-certified pediatrician and is the Director of Telemedicine at Pediatric Associates.
I'm excited to have you back. As I mentioned before we were recording, it's like very unusual for me to have a repeat guest. So only the very few get to come back because I feel like there's some unfinished stuff for us to talk about. And neurodiversity has come up a lot for some reason this season on the podcast. It was sort of this like running theme that kept reappearing when we talked about all sorts of unrelated things. So I felt like it deserved its own dedicated episode. So I think you're a great person to have that conversation with. But first, what does that actually mean? What is neurodiversity?
Okay, so you're right. This is a big topic in general, and it's a growing topic. People are getting much more aware, and I think that's great. So neurodiversity is a term that was first described by Judy Singer. She's a social scientist who has autism herself. And this is just a word which is meant to encompass the diversity of human minds. You know, there is a big variation in neurocognitive functioning, and this is just meant to reflect that. And this is a biological fact. There's no one normal brain or one healthy brain. There are lots and lots and lots of different ways of having a brain, and that's good. And it's important to recognize that. So because we have neurodiversity and we have many kinds of brains, we have what we think of as normal. And normal always goes in quotes because there's really no such thing as normal.
I hate that word.
It's a terrible word. It's a terrible word, yeah. But that's the word that we all default to. I say normal just means most common way of doing something. It doesn't mean best way, it doesn't mean worst way, it just means most common. Like brown hair and black hair, that's the most common. Is that normal? No, that's the most common. I have red hair. You can say I'm not normal for a lot of reasons, but you know, this is just a variation, a difference. Does this mean anything in terms of health or life or anything? Well, yes, people who have red hair are more sensitive to the sun. I will absolutely burn faster than people with darker hair in general. But it's a variation. It's not a bad thing. It's just something I need to think about more.
I've made an effort recently to start avoiding, like to move away from the word normal for all sorts of reasons that you mentioned, because I think it reinforces like an impossible standard or inaccurate standard. So when we talk about neurodiversity, I like to use the word neurotypical when I need some kind of baseline to refer to. Is that kind of okay? Is that accurate?
Yes, absolutely. And I do exactly what you do for very similar reasons. Something which I just learned last night, I happened to come across this. We think of the word normal as being this old, very established word that's been around forever. It was actually first really came into use in the 1860s, not to mean, most common way of doing things, but to mean the ideal. So I'm like, so this word isn't as set in stone as we want to. So yes, so we have this word neurotypical, which just means having a style of neurocognitive functioning, brain function, that falls within the dominant social standards of normal. So Is that just a fancy way of saying normal? Uh, yes, but also no, because it's saying this is the most common way that people's brains are wired. Not necessarily good, not necessarily bad, but most common. And because it's the most common, this is how our society runs. This is what we're adapted to. This is what's the easiest way to get by. Now, we didn't get the word neurotypical out of nowhere. It came because we started saying, well, what about these people who have different brains, differently wired brains? And the word that we're using for that now is neurodivergent. So we're saying neurodiverse reflects a population. A person can be neurodivergent. They have a brain that works in a way that's different than the usual standards of what we try to get away from calling normal. So is this a good thing or bad thing? It depends on the person. It's just your brain. Some people are wired differently. This was first really embraced by autistic people. And just a quick sidebar, in medicine, a lot of times we've been trained to do person first language, person with autism, person with diabetes. But if you talk to autistic people, they will say, no, autism isn't a disease that I happen to have. Autism is part of who I am. It is part of my personality. This is who I am. You can't separate the autism from the person. I am an autistic person. And of course, everyone has their own preferences, and it's always best to ask. But in general, the autistic community is preferring the use of autistic as the adjective. And they say, autism isn't a bad word. Why are we making it a bad word?
Right, it's just a descriptive word.
Exactly. It's saying, this is the best way we have of describing your weird, wonderful, quirky brain. Let's use it.
I like that. I didn't know that. I think like sickle cell is a common one where like it's very important for us to not call anyone like a sickler, right? That's considered offensive, and so we say, right, a person with sickle cell, a child with sickle cell. But you're right. If by using autism in that same way, we're saying that it's a disease, it's a pathology, and that
Yes.
may not necessarily be true, which is kind of what I want to get to. And so maybe let's go there now. What's the distinction, or is there a distinction between a true disability, a pathology, something is wrong, and being neurodivergent?
Now, that's a really good question because it covers a lot of ground. There's a lot of gray area here where we're going from difference to disability. So, brains are different. Brains do different things in different ways, and some of them are more efficient than others. So, one of the more helpful ways I have of looking at this is, and it gets slightly technical, but not that technical, is looking at different models of disability. So we have the medical model of disability. Your body, think of your body as a machine that you need to fix in order to conform with normative values, how we expect our bodies to work. So what happens if you can't climb stairs? Oh, well, then the medical model focuses on, let's fix that body. Let's fix why you can't climb the stairs. And okay, but one, that may take a while. Let's say you have a broken leg, that's going to take a while to heal. Let's say you have cerebral palsy and you know, we are not at the point in time where we can fix, and again, fix goes in quotation marks, that disability. That's not going to change anytime soon. Let's say you're someone who sometimes can climb those stairs because, you know, you're having a good day, but other days, you know, you have multiple sclerosis and, you know, you have fatigue or you have dizziness, or you're someone with cerebral palsy who is able to walk, but it is hard for them. So the disability is because you can't do what you need to do. You can't climb those stairs. If we look at the social model of disability, we're saying, okay, it's not so much that you're disabled because you have this impairment. It's because you can't do what you need to do. So if you have someone who uses a wheelchair and you replace those stairs with a ramp, now that person can get where they need to go. Their impairment is no longer disabling. That doesn't mean that, you know, we're ignoring all the other differences and difficulties that a wheelchair user has, but they are able to get where they need to go. So another thing I came across recently, which blew my mind, is imagine what would happen in a world where we had no wheat, barley, or rye. Wheat, barley, and rye went extinct. Well, no one has celiac disease anymore. Well, they do, but it's not causing them problems because there are no foods left to trigger their symptoms. So some things are impairments only in the context where they're unavoidable. There's nothing we can do for it. So something I like to say is we should avoid pathologizing. Let's not make all differences problems. Some are. So, there are absolutely things that make life more difficult. Then there are other things that, yes, it's a difference, but it's not necessarily a bad thing. Another one of the, now I use a lot, because I see kids and families, I use a lot of analogies. And one of my very favorites is, think about lefties and righties. Do you know anyone who's a lefty?
Sure.
Yeah. 10% of the population are lefties. 90% are righties. So that's a lot of righties and not too many lefties, which means that lefty problems are pretty invisible to that 90%. We don't think about it. So when you were in school, did you ever get stuck using the lefty scissors?
Oh, it's like so uncomfortable and feels like very like it, all of a sudden you have to think about what you're doing.
Exactly. You're twisting your hands trying to make these scissors work. Why won't they work? Who would use these ridiculous scissors? Well, that's what lefties are dealing with all the time, because usually there's like one set of lefty scissors in the classroom if you're lucky. For the rest of the time, if they don't have those lefty scissors, they're struggling. Or can openers are apparently handed. I didn't think about. Or think about the mouse pad on the computer, which is something that I think about because I'm a righty, but my mom was a lefty. So growing up, I used the mouse with my left hand. And I was so used to it. It took weeks before I had my own computer where I accidentally used it with my right hand. I'm like, oh, this is so easy. So it's not that it's bad to be a lefty, but it is more difficult. So one of two things happen for lefties. Either they struggle to get by in this right-handed world, which is what most of them do most of the time. And sometimes when they're lucky, we have the right accommodation so that they can do things more easily, because there's nothing wrong with being lefty. It's just less common, so not normal. There's that word again. But these are things that we can accommodate if we are thinking about them.
So I think that's it's important now to maybe talk about the idea of neurodiversity, and by using that word, does that mean we're necessarily saying that we no longer need to accommodate or support anyone? It's okay that you're neurodivergent, but like this is our world, so figure it out. Because that's not what we're saying, right? The
No.
value of recognizing it is that now we're all empowered and we will be more aware of support that we can give these individuals.
No, that's exactly it. We're saying these are awesome people with awesome brains, and we need to figure out ways to support them. Because if we have all these different brains in the world, well, we should do our best. The idea of inclusivity, which is really a big idea these days, which is great. We're thinking, how can we include everyone? How can we make things as inclusive as possible for the majority of people? And that should extend to neurological differences, because, well, one, it's fair. We want to do our best for as many people as possible. And also, not that this is a reason to do it. We should do it because they are people and we take care of people, but these are people who can succeed, who can do amazing things if they are given the right supports and the right strategies.
And who can contribute, right, in a way that maybe neurotypical people just can't.
Absolutely. When I'm talking to my families, because of course, as a pediatric neurologist, I spend a lot of my time seeing kids with neurodivergence, kids for autism and ADHD, and I say, no, these are not bad brains. These are good brains. These are brains that are wired a little bit differently, so you see the world differently, and that is valuable. This is why we have so many scientists and computer people. All the computer people. All right, that's a stereotype, and I shouldn't say it, but This is one of those areas.
No
where
offense to
people,
computer people listening.
no offense to computer people, because my other go-to example is neurologists. In neurology, we are infamous for being very spectrum ourselves, and I 100% include myself in that. I know where I fall. I do. But no, these are different brains with different abilities to see the world. I saw something not too long ago saying, you really think it was those social cave people yakking around the fire at night who came up with the first, sharpened flint spear? No, that was the person hiding in the cave, away from all the talky people who said, let me hyper focus on this and let's see what happens. And so there's a reason why people with neurological differences are overrepresented in science and arts and creative fields, because these are people with great brains, but many of them will never figure it out if they're not given the right kind of support, because it's not a one-size-fits-all deal here. We want it, and even within the spectrum of neurodiversity, we can say, oh, you're autistic, therefore you need X, Y, Z. No, you say, you've met one person with autism, you've met one person with autism.
I love that saying, yeah.
So what works, accommodations and support that work for one person may not work for someone else. Maybe someone with autism, they need a quiet, very structured situation so they can do their work. Maybe someone with ADHD, they got to be moving around and active and humming and fidgeting. That's what they need in order to be most productive. Now, those two people, they both have their own separate needs and they don't match up, but they don't have to. It's saying what works for one person doesn't work for another person. So being inclusive doesn't mean for everyone all at once, all the same. It's saying, okay, how can we best work with each individual person to see how we can help them?
Yeah, so I wanted to get a little bit into what does support look like, which I think you touched on a little bit here. But when we talk about supporting neurodiverse individuals, I think it means different things at home, right? It means different things in the classroom. What are some ways, for example, that parents can support their neurodivergent child?
The most important, by far, number one on the list is love and acceptance. Your child is not broken. Your child is awesome. And I focus on this because when you come to see me as a neurologist, really what you're saying, what's wrong with my kid?
I need to go see the doctor. Something is wrong, right? They need
something's
to
wrong with
fix it.
Exactly. We don't need to fix your kid. We need to figure out what's going on, because maybe your child needs something else. They have different needs. And once we can address those needs, they can flourish, they can bloom, they can grow. So, no, these are awesome kids. And this is important to know as parents, because, as parents, we worry, but also so you can transmit this message to your kid, because it is so easy for kids to pick up on this idea that there's something wrong with them. Kids are smart. If you go to a class of kindergarteners or first graders and you ask them, who's the smart kid? They'll tell you. Who's the funny kid? They'll tell you. Who's the bad kid? They'll tell you. They know where they fall in the pecking order. And once they get these ideas of themselves as the bad kid, the hyper kid, the problem child, it is so hard to move past that kind of negative thinking. They think of themselves that way. And we're saying, no, there are no bad kids, but there are certainly kids who have higher support needs. There are kids who have different support needs, and we need to find out what they are. So, number one, love and acceptance. This is your kid. Your kid is awesome. Let's find out how to raise them into the happiest, healthiest, most independent versions of themselves that they can be. Then we say, okay, listen to them. So it's really easy as a parent. We jump into problem solving mode. We want to fix everything for them. They're our babies. But no, first, ask them what they need and how they feel. We want to listen, we want to validate, we want to empathize. Because some human things are pretty universal. Others are, well, if their brain is wired differently than yours, what's easy for you, just saying, go over and talk to them, that may feel like a huge mountain for them.
Yeah.
So your experience may not carry over to them. So first, listen, try to figure out what's going on in their head and what they're asking for in terms of help. They may not want you to fix everything. Sometimes, we want people to fix things for us, but no, listen to what the problem is and how they want to go about fixing it before leaping into action. And as we're trying to, understand their emotional experiences, well, that also we need to advocate for them with the school, with society at large, with the rest of the family who may not get it. They come on, just push them a little bit, more discipline, spank them. Please don't spank them. You know, different ways we can help in school, different therapies, educational support, scaffolding. This is not to fix them, but to help them. We want them to learn how to be able to do these things as much as possible. And then for little kids who can't really explain why they feel this way, or for older kids who aren't able to communicate this, in a way that we can understand, don't just try not to assume that they're being bad just to be bad.
I see this a lot, right? Where it's recognized as a behavioral problem. But like you say, it's not, nothing has gone wrong. They're not broken. This is a different, right? Just different. And we need to figure out a way to channel that energy maybe somewhere else.
Yeah. And again, this is hard. I'm a parent, so I know that this is a hard thing, especially when you're really frustrated. But almost every time kids aren't, being bad, and that's another one that goes in quote marks, they're not being bad. Yeah. They're not challenging us just for the sake of challenging us. Try to think of this as, what do they need? What unmet need are they not being able to express? What do they want? What do they need? What do they feel? These kids, when they're frustrated, they have outbursts. And as parents, as adults, we have to be patient and try to figure it out as much as possible without getting mad. But of course, we're human beings too. So sometimes we just have to take a deep breath, step back from the situation, and come back when we can. But
I think that's great. I think that's great parenting advice. I think for any, any child, neurodivergent, neurotypical, I think great, maybe probably life advice for dealing with individuals that challenge you. But I want to ask one more question, because I talk to parents and families a lot about how to prevent behavioral concerns, or how to provide emotional support for their child and really help them develop socially and emotionally. And a big thing that I like to focus on is structure and routine and schedules, and making sure kids know what your expectations are, and printing a schedule. That's something that I really empower families to do. And somebody recently sort of challenged me on this and said, that sounds great, but I have an autistic kid. I was going to say child with autism, right? I have an autistic child. And is this something that you would still recommend? And my initial instinct was say, oh, all the more so, right? Because I know autistic kids really struggle with changes in going from one task to another, and transitions, and having an expected schedule for them is actually something that's really helpful for them. And then I sort of questioned myself on that a little bit, because maybe that's not the right answer, especially when we talk about neurodiversity and having a more tailored approach for each kid. What are your thoughts on that?
That's actually a really good question. And the answer is, in general, this is the in general, I don't know if I should say most, many autistic people really do thrive on routine. Why do we like routine? We know what to expect. When we know what to expect, that reduces anxiety. When anxiety goes down, we can live our lives and do what we want to do. So in general, and again, always allowing for exceptions, most autistic people, I think, would prefer to have strong structure and routine. And when we need to change the structure and the routine, a lot of warning, a lot of explanations as to why. Because that's one thing that autistic people will say. It's okay, I'm not going to accept it just because, they appeal to authority. I need to know why it doesn't work this way. If I know why, then I can work with it. Then my brain can start to bend around it. Now, does this structure and routine work for everybody who's neurodivergent? Not necessarily, because nothing is 100% in life. But also, neurodivergence extends from autism, which takes up a lot of the conversation, but it also includes people with ADHD, people with learning disabilities, people with OCD and anxiety, Tourette syndrome. those are all innate. And something that I hadn't thought of, possibly because I spend all my time thinking about kids, is you can also have acquired neurodivergence. Let's say if you have a traumatic brain injury, you have a stroke, people who develop dementia. So you can become neurodivergent. So the needs of someone with ADHD may be different from someone who just has autism, although of course there's also a lot of overlap. You can be multiply divergent. So someone with ADHD may need and thrive on that chaos. They can't find anything, but that's, letting the creative juices flow, and
They're
they feel
productive
safe.
that way. They're
Exactly.
productive that way. Whenever people talk about this example, I always think of the ER doctor, right? In the ER, and they thrive, and they'll admit it. They'll say, I struggled, right, with ADHD. Now I'm in the ER, and I need to do 500 things all at once, and I love it, right? And they're very successful that way.
That is absolutely it, because I say there's a place for everybody. And yeah, anyone who has spent any time in the ER or among people who work in the ER, there's a reason that stereotype exists. There's a reason that, neurologists tend to be a little bit off kilter and spectrum. You know what? And it works. There are so many people walking around who absolutely would have these conditions, but if we start going back 10, 20, 30, 40, 50 years, no one was getting diagnosed with anything. You're a weird kid, get over it. You're hyper, settle down.
It's a problem. It's a problem. Figure it out. But
exactly. And
not.
that these parents and grandparents are now bringing their kids who are just like them to me. And I'm like, okay, well, who does he take after? They're like, well, I was never diagnosed, but. And then I tell them, I learned a great saying when I moved down to Florida. You don't get apples from a mango tree. So you start shaking that family tree, you're going to see who falls out. That's why I say this, this is nothing new. People are people are people. We have been people for hundreds, thousands, tens of thousands of years. If you go back to the cavemen, you're going to find people with ADHD. You're going to find autistic people, and that's okay. This is just how people are, and we need all kinds of brains in order to be a wonderful, diverse human community.
I love it. So this was actually our last episode of season 2 for this podcast. I think it's the perfect way to end like a whole almost year's worth of discussion on pediatrics and on children and on health, because I think it's just a great capstone to kind of summarize what really we want as parents, what we want as pediatricians, is just for our kids to be loved and accepted, and for us to be able to find ways of supporting them so they can thrive and be the best version of themselves.
No, it's a pleasure to be part of it. It's an honor to come back.
Thank you so much. Thank you. I loved having you back. And I may break my streak of never having anyone on more than twice, because I just feel like I could talk to you and ask you so many questions. So
no,
thank you again.
This is so much fun. I'll come back anytime you want me.
Thank you. Thank you.
Make sure you like us on Facebook and follow us on Instagram and Twitter. Thank you for joining us on KidzDocTalk.